Hello, my name is Ella Hammond, and my persuade to speak is on elder abuse. And I chose that topic because I've been working in the medical field for 20 years, and in those 20 years, I have first-hand experience patient neglect. And one example I want to tell you about is I had a patient one night, and they was complaining about they couldn't breathe. And I went right away to the nurse and told the nurse to what the patient was saying. And I'm looking for her to jump up and come run to see uh, what's the problem. And her response was, she complains and she does that all the time. So that whole night I was on edge because I was especially uh, looking after her because I felt like, something might happen that night. But I gave her a little bit more attention because of the fact she was complaining about the breathing. But the next day, I reported to the supervisor how the nurse responded to me about the patient. And and then her response as an administrator, she would take care of. And come to hold that all they did was cover it up. In that position there, I left. And it's a couple positions in nursing homes I have worked at that I wasn't satisfied with how they was treating patients. So I didn't want to be in that atmosphere like that. So I left the job. And the reason I left the job, I wrote it down, is because I felt like the facility uh, did not give care as good as they could. Elder abuse is is intentionally or unintentionally hurting, whether it be physical, mentally, sexual, financial, of a person who is age 60 or older. Elder abuse is an unrecognized problem with devastating and even life-threatening consequences. And the type of elder abuse are physical, which is like hitting or slapping, emotional, verbal insults, neglect, denial of essential services, sexual abuse, touching, kissing, fondling, without the patient's consent. And elder financial abuse is the misuse of the elder's money. Uh, some signs and symptoms of an elder abuse could be a change in the personality, the behavior changes. The physical abuse could be where you see bruises, pressure marks, even a black eye, burns, or broken fractures. And some signs of emotional abuse would be if they're upset, agitated, rocking back and forth, or being withdrawn. And some sign of neglect would be dehydration, malnutrition, extremely hungry, untreated health or medical problems such as bed sores. I feel like some causes of abuse might be, um, first of all, I feel like caregivers are special people. It takes special people to take care of patients, and they will feel like they enjoy the job, and they get a thrill out of making a difference in one's life. And some of the caregivers are not suited for the job. They're impatient, and it could be cause of inefficient staffing or lack of training, stressful working condition, or the staff just burn out. But and then some of the results from elder abuse could be a inability to move, incontinent, longer time to heal pressure sore, the bed sore, dehydration, starvation, malnutrition. All of these things is result of elder abuse. I think the key elements for preventing elder abuse is be educated, enforce, and intervene. Just don't not do anything about it. Get involved. And because these patients, they can't, a lot of them can't take care of themselves. That's why they're there. And they look for the caregivers to give them what their needs are. And the elder abuse usually occur in one or two places. One in the home or in a long-term care facility or institution. But elder abuse in the nursing home has recently gained media attention, which is good. And federal programs has been established to help prevent and resolve such abuse of elders. And thank you for listening to my presentation, and I hope it was beneficial. Thank you.